Autism is a condition or disorder of the brain. It is often seen in very young children. It's mainly a communication disorder. So it means that it affects the way the person receives information and the way the person gives out information. And it's lifelong. So that's mainly what autism is. The very first thing most people would notice is inability to talk. So that is the clearest sign. But in addition to that, we also have defective non-verbal communication. So the child is not able to gesture, point, to communicate, to show their needs, or to tell the people around them what they want. They also may have some other behaviors, such as repetitive things, like they'll be interested in some particular toys or foods or some textures that may not be usual for children their age. And they may also be overly sensitive to some of these textures or sounds that is also normal for children their age. So it's difficult to pinpoint one particular cause of autism. It's a complex interaction of different things. But the main thing is that there must be a genetic risk. So what that means is that somebody in the family may have something that looks like autism. It may not be the full expression like the child that may be before us, or maybe we may see all the issues with talking and nonverbal communication, but the genetic risk may be there. And then there may also be something that happens around pregnancy and delivery. So if it's a difficult pregnancy, there was bleeding, or during the labor, the child didn't come on time, or the child had yellowing of the eyes or jaundice soon after delivery. All of this in interaction with each other may cause the child to have autism. Not at all. So a lot of people with autism are able to live a full productive life. Once it is recognized and the right interventions are put in place, the child or the person is not useless at all. They can live a full productive life. Yes, so autism tends to come with other mental conditions. The commonest are anxiety, um, conditions. And the reason for this is that as they are struggling to communicate and interact with the world around them, they may become very frustrated by the inabilities or their difficulties with the interactions. And this can cause a lot of anxiety. They can also have what we call obsessive compulsive disorder. And it is also a type of anxiety disorder, which is closely related to autism. They can also have seizures. They can also have depression. So they can have a whole lot of other psychiatric conditions. Because of the complexity of the cause and the interaction, it's difficult to prevent. But some of the risk factors can be modified. So making sure that during pregnancy you receive the total care in a hospital, making sure you take your vitamins and deliver in a hospital, so that when there is difficulty, interventions can be put in place to deal with it. So we can't prevent the genetic risk, but the associated risk like pregnancy, delivery, early childhood can be modified. For parents with children with autism, it is important that once you see signs that are suggestive, you think that this may be autism, immediately bring the child to the hospital for assessment, full assessment. sometimes we may see that it may not be autism. If it is autism, the earlier we put in the interventions, the better. And this will make the child's life better. So immediately you find that there's a delay in a child's communication, immediately bring the child to the hospital for assessment and management. One can access help in all the psychiatric hospitals. Any medical doctor can assess and guide you to the right resources. You can also see any psychologist that you know. They can also assess the child and direct you to the right resources. We also have mental health personnel in all the regional hospitals in Ghana, all the district hospitals in Ghana. They can also assess the child and refer you for treatment. So autism is a disorder that doesn't mean that the child is hopeless. It can be helped. There's a lot of resources available. The earlier the assessment is done, the better for the child and the parent. Thank you very much.